We are back with more What's Now. I recently was able to speak with race car driver Chris Arthur all about his struggles with ulcerative colitis. He joined us along with a physician to give us some insight about this chronic disease. Here's more.
When a chronic disease kept him from pursuing his dreams as a race car driver, Chris Arthur set out to find the right doctor to help him manage his condition. After years of navigating the ins and outs of living with ulcerative colitis, this Hollywood stunt performer, athlete, and devoted father is here to share his story. Chris joins us now to explain why it's important to keep searching for a solution while never giving up on your dreams. Joining him is Dr. Kornbluth, clinical professor of medicine at ICANN School of Medicine at Mount Sinai and in private practice at New York Gastroenterology Associates. Going to talk about inflammatory bowel diseases like ulcerative colitis and strategies for managing this condition. Thank you, Dr. Kornbluth and Chris, for joining us today.
Thanks for having us.
Thank you. Appreciate you having us.
So, Dr. Kornbluth, what is ulcerative colitis and how can it impact patients?
Okay, so ulcerative colitis is a disease that is itis, inflammation of the colon, which is our large intestine. And the job of the colon is to absorb water. So when the colon isn't working well, we end up with loose stools, watery stools, and unfortunately sometimes bloody stools. And with its similar sort of sister disease, Crohn's disease, there are actually 3 million people in the United States living with this disease. And if that sounds odd to you, and you might say, gee, I can't imagine it's that many, I don't know anyone with this disease, it's because this is not a cool disease to talk about. People don't want to talk about these kind of symptoms despite this coming on in your teens, 20s, and 30s, and really, truly being a lifelong disease. So it's important that when a patient comes in, we really ask about how this is impacting on their life. And as you'll hear from Chris, he was starting out his career as a race car driver, and that impacts him in one way. It might be very different than impacting a 50-year-old professor who has to worry about running out of a class of 200 students. Every patient has their own colitis. It's very important for us as the physician to pay attention not only to the physical symptoms, but also how it's affecting them mentally, and also very important to think about how it's impacting them socially, school, work, social life, all very important facets of this disease.
So Chris, tell us a little bit more about yourself and when you were diagnosed with ulcerative colitis.
So I was diagnosed with colitis at age 19, and UC is part of my identity now. Fortunately, it does not define me, and I have been able to go on and live a pretty amazing life, which is in total contrast to where I was when I first saw Dr. Kornbluth. I was in really bad shape. I had lost a tremendous amount of weight, and I was suffering from all the other symptoms that he mentioned are associated with ulcerative colitis. So the journey has been incredible. I actually was out in Park City this summer and was able to ride mountain bikes out there with my kids. And it's something I never would have dreamt would ever have been a possibility when I was really sick when I first met Dr. Kornbluth. So having met Dr. Kornbluth and having the right doctor and being prescribed the right treatment is incredibly crucial. And for me, working with Dr. Kornbluth today, working with Janssen, and bringing you this message to hopefully help other patients is really rewarding.
Well, that is really great to hear, and I'm glad you're able to come out and enjoy our beautiful small town with your family mountain biking. Tell me more about your relationship with Dr. Kornbluth and how it really changed your experience with ulcerative colitis.
So finding the right doctor, I think, is really a crucial piece of the puzzle here with dealing with Crohn's or colitis. And he really did change the trajectory of my life. And not only by prescribing me the right treatment, but by being very supportive. His ability to listen and understand me as a patient, my needs as a patient, were absolutely paramount in getting me to where I am today.
And Dr. Kornbluth, how do you approach working with people like Chris to help manage their condition?
So I think Chris was sort of alluding to what we hope to offer is giving the patient hope, because they hear this as a chronic disease, and frankly, they'll need to be on medication for the rest of their life. Unfortunately, we now have new biologic drugs. We have more drugs in the last few years than in the last 50 years combined. So we have a lot of medications. Most patients, many patients, we will be able, thank God, to get well with this constellation of medications we have. But it's also very important to think about what their colitis is. Chris's colitis, when he's starting out as a race car driver, might be very different than a 50-year-old college professor who has to worry about running out of a class and finding a bathroom in the middle of a class of 200 students. So it takes some listening, not only what their career looks like, but how it is affecting them mentally. Is it stopping them from taking classes? Is it stopping them from dating? So it really takes the time to listen. There's a lot of hand-holding, a lot of support, but again, thinking about treating the patient early, because this is a progressive disease, and finding the right drug for the right patient at the right time, and trying to prevent the progression of this chronic, progressively destructive disease.
Well, and finding the right doctor as well, Chris, what was the key to that? And do you have any advice for other patients who have ulcerative colitis?
Absolutely. I say it's a little bit like dating. Maybe you get lucky and maybe you find the right doctor right out of the gate, but chances are you're probably going to have to see more than one doctor before you find that perfect fit. And finding that perfect fit, a doctor that you can communicate well with, who understands your needs and can get you on the best treatment path, is really imperative to one's success with dealing with this disease. So yeah, stay the course. I know it's not easy at times, but there is a lot of hope out there. So thank you for having us. I really appreciate it.
Well, thank you so much for joining us today and informing our viewers about ulcerative colitis and different options and your struggles with it, Chris. Thank you for being so open about that. And thank you, Dr. Kornbluth, for being here today to give us more advice on managing this condition.
Absolutely.
Thanks so much for having us. Thank you.